My name is Professor Bhik Kotecha. I'm a consultant ENT surgeon and I have a special interest in sleep medicine. I've been doing sleep medicine for the last 25 years or so, and I'm interested in evaluation and treatment of sleep disorders such as snoring and obstructive sleep apnea. Obstructive sleep apnea is a condition that happens in sleep due to upper airway obstruction. So if I can use this model to demonstrate that the airflow from the nose, down the back of the nose, behind the palate, behind the tongue and into the larynx can become obstructed during sleep. And as a result, you can get oxygen deprivation and you will have a condition called obstructive sleep apnea. Generally, these patients present with a turbulent airflow, which results in snoring and breath-holding episodes. So first of all, there are certain factors that aggravate obstructive sleep apnea, and some of these are being overweight. So obesity is something that makes sleep apnea worse. So weight loss would certainly help. There are other factors such as alcohol consumption that can also aggravate matters. So alcohol is muscle relaxant, and cutting down on alcohol would also result in improvement of snoring and sleep apnea. So those are the two lifestyle changes that people can make. Thirdly, sleeping on your back can aggravate matters, so not sleeping on your back can also improve things. However, one needs to address the obstruction from the nose all the way down to the larynx in order to overcome the treatment, or overcome the problem rather. And this would include either using surgical treatment modalities or non-surgical treatment. Obstructive sleep apnea can be treated with a variety of treatment modalities. And if a patient has moderate or severe sleep apnea, then the treatment of choice would be to use nasal CPAP, which is continuous positive airway pressure. This involves using a mask on your face, and from the mask, there's a tubing that goes to a generator, which extracts air from the room and delivers it at positive pressure, therefore allowing the patient to breathe throughout the night without obstructing. This would improve the oxygen saturation, it would improve the quality of sleep, and would treat and cure sleep apnea. If they're unable to use that, there are other devices such as a mandibular advancement device, which is like a gum shield. This is inserted inside the mouth during sleep, and it protrudes the lower jaw forward. And by doing so, the tongue comes forward and the airflow improves. However, people don't like sleeping with devices in their mouth during their sleep. And as a result, there's an innovation of this new device called OSA, which is used before a patient goes to sleep. So this is used by applying it to your tongue, and there is a device which will then link up with your Bluetooth and stimulate the tongue muscles for 20 minutes before you go to sleep. And as a result, the tongue will become better toned and sit forward, and therefore avoid the obstruction of the upper airway. However, non-surgical treatments will not always work, and therefore surgery to correct the upper airway may be necessary. In order to do this, one needs to identify where the problem is, and this could be at the level of the nose, inside the nasal cavity, caused by problems such as a deviated nasal septum or nasal polyps, and this could be addressed surgically by septoplasty or by performing endoscopic sinus surgery to remove the polyps. The commonest operation, however, would be on the soft palate. The soft palate and the uvula inside the mouth could be vibrating during sleep. That's in the region up here, and that can be shortened and stiffened by surgery. And there are different kinds of surgical interventions, such as using laser or radio frequency. Treatment to the tongue base is also possible, and this could be done by using radio frequency treatment to make the tongue less bulky. In some patients, however, you may need to combine surgical and non-surgical treatment modalities in order to get the best results. So the success rate of treatments can be quite variable. It depends on the patient's compliance. For example, nasal CPAP is 100% effective, provided the patient uses it for the whole 100% of their sleep. Some patients will take it out in the middle of the night and only use it for 60% or 70% of the night, and the success rate is about 60 to 70%. Likewise, with the mandibular advancement device, if they can retain the device throughout the night, then the success rate is quite good. Surgery does not give you 100% outcomes, but it does give you anything in the region of 60 to 80% improvement in the snoring and sleep apnea parameters, provided the patient selection criteria are followed strictly. Obstructive sleep apnea can be lessened or reduced by certain lifestyle changes like weight loss and cutting down on alcohol. The surgical intervention can correct the upper airway, but in many cases, it is difficult to completely alleviate the problem. Some of this is because as we get older, the muscles become quite lax, and that's the reason why we might need surgical and non-surgical treatment modalities combined in order to get the best outcome as possible. Some of it is genetically related, and morphologically we have inherited the structures of the upper airway from our parents, and this can't be altered completely by surgery. And for this reason, we may have to rely on non-surgical treatment options as well. So the OSA treatment approaches have been revolutionized, and we have robotic surgery, which can help patients who have a big tongue base or epiglottis that is causing a problem. And robotic surgery can be performed in patients who are carefully selected for surgery. There are also operations performed on the neck called the hypoglossal nerve stimulation. And this is a novel technique whereby the hypoglossal nerve, which is the nerve that supplies the tongue, is stimulated by a little device which is inserted inside the chest, and this will observe or detect the breath-holding episodes. It will then trigger off a response, and the nerve will be stimulated. This is something that has been developed in the last 8-10 years, and more recently there's a new device that can be implanted in the base of the neck, which will then stimulate both sides of the tongue, both hypoglossal nerves, as opposed to the previous one that only stimulates one hypoglossal nerve.